Did you know Americans spend the most on healthcare and get the least in return? Even though we spend $4.5 trillion on healthcare each year, people in the US, on average, live sicker lives, die younger, and have much more difficulty getting the care they need. America is an extreme outlier. Among 10 nations, its health system ranked last. On nearly every measure of performance examined, America fails to meet the basic needs of its citizens. So, what is the US getting so wrong that other countries are getting right? First, the US is the only high-income country that doesn't offer universal health coverage to its citizens. There are more than 26 million people in the US without health insurance. That's 8% of the population, and while it's a much lower figure than prior to the enactment of the Affordable Care Act, it's still too high. It's one of the key reasons US healthcare doesn't work as well as it could. Second, American healthcare is expensive. Millions of people struggle to afford it, and some have to choose between buying food or getting needed care. Regardless of how much money they make, Americans are more likely to skip going to the doctor and not fill their prescriptions because it is too expensive. In the end, they may go without the care they need until they are very sick and require even more expensive treatment. This has consequences for the whole health system. Sicker patients needing more expensive services means higher out-of-pocket costs for the patient, higher premiums for employers, and increased strain on health workers. In contrast, when you go to the doctor in the UK, it's free. Cost rarely prevents patients from getting care to treat illness. It's no surprise the average life expectancy in the UK is at least 3 years higher than in the US. The US must ensure all Americans have access to affordable coverage so they can stay healthy for as long as possible. Third, Americans lack primary care. Americans are more likely to report they don't have a regular doctor than people in most other countries. In the Netherlands, by contrast, nearly 100% of people have a regular doctor or place of care, and primary care physicians offer home visits, making it more likely people get the care they need when they need it. To bridge these gaps, the US must increase investment in primary care and take steps to grow the primary care workforce. Given the massive amounts of money pouring into the US healthcare system, Americans should be receiving exemplary care. They are not. By guaranteeing coverage for all, ensuring care is affordable, and investing in primary care, the US can move toward improving its health outcomes and providing better care for everyone.